previously healthy 9 years old male patient presented with our hospital with complaints of involuntary, brief, random, and irregular movements in his arms over the past 8 weeks. And in other center, he diagnosed with Sydenham chorea, but without mood changes.
So the clinical preliminary diagnosis is myoclonus dystonia syndrome due to SGCE variant. This is a syndrome that starts in childhood. It is related to the variants in the SGCE gene, which encodes epsilon sarcoglycan. This is a transmembrane protein with a brain-specific isoform, especially expressed in the cerebellum.
For a brief information for Huntington disease, it was first described in 1872 by George Huntington. He was only 22 years old when he described this disease. And interestingly, during his medical career, he only had 2 papers. And the first of these 2 papers was the one which he described Huntington disease. And more than 100 years later, the Huntington disease was linked to chromosome 4. And 10 years later, it was shown that it is a triplet expansion repeat disease.
In adolescence, chorea is rare to almost non-existent. It's typically dystonia and Parkinsonism, but unlike the adult, where early on the pathology is seen almost exclusively in the striatum, in juvenile Huntington disease, sometimes called the Westphal variant, but juvenile Huntington disease, there's pathology seen in the cerebral cortex very early on too.